Thank you, Kate. My name is Dondre, and I work here on the Global Safety and Security team, soon to be renamed. I am going to speak with you about culture shock, mental and physical health, international health insurance, and international SOS, which is our international assistance provider. Okay, so of course, one of the best things that you can do to prepare for your program is to plan. If something like, feeling homesick or losing your medication or getting injured, if one of these things happens, it's good to have a plan so you can go ahead and execute that. If you don't have a plan, then that's just going to add to the stress of that. So, just think ahead on what you're going to do if one of these things happens, and also know that we're here to support you. Okay, and in regards to mental health, of course, this is something that is gaining like increased recognition, and something that folks are trying to take care of themselves in this way more so, and more openly. So I would just recommend that you think about what you're bringing on your program. If you have any sort of medication in terms of your mental health. Just know that you'll need to look into whether or not that medication is legal in that location. If you have any questions about that, we can have you reach out to International SOS so that they can work specifically with you and your needs and figure out what the best plan is. In some cases, you can get your medication, you can get an extended supply prior to your program and take that with you. In other cases, it might not be legal, much ADHD medication, especially in Southeast Asia, is not legal. So you might have to find a local alternative or look into another way of managing your mental health. And what are your coping strategies? There's a list of those in the next slide that we will go over. And additionally, consider the cultural and identity differences. I studied in Morocco myself, and a very good friend of mine studied there shortly before I did, and she had a very different experience because of the difference in identities. And also, she was there during Ramadan, and I was mad jealous of that. And again, please have a plan in place so that you're able to think ahead. If you already have mental health struggles, then it's a good idea to think about what you're going to do when you're there, because you do take your whole self with you on the program. Thank you. And here is the list of common coping strategies. I'm not going to read the entire list, but I do recommend, of course, limiting your social media exposure. Using too much social media can be bad for your mental health. It's also a good idea to exercise and to be outside in nature. If you're going to be studying abroad in a concrete jungle, then maybe try to find a park or figure out where you can find some safe hiking trails and so on. And just think about creative expression and also utilizing your support system that you have here in the States, and also trying to build one while you're abroad. And culture shock, that's something that all of us experience, at least to some degree, while we're abroad. When you first get there, there's that honeymoon stage. You're just wonderstruck with the location. You're so happy with the architecture, the food, and the experiences that you're having, and everything is so new. And then you kind of hit that stage of culture shock. And much of culture shock is that level of culture that you don't really see on the surface, the stuff that kind of takes a while for you to process and understand. And typically that stage of that lull and that acculturative stress, culture shock process happens about halfway into the program, at least for folks who are abroad for a full semester. So if you do hit that point, and you're kind of hitting a lull and having some struggles, just know, of course, that we do have mental health support. The insurance policy that we will discuss soon does cover mental health support. And of course, once you get through that stage of culture shock, which can be ongoing, and can manifest itself in both physiological and psychological ways, you'll kind of hit that adjustment and be very happy with where you are, and start to adapt to where you are and want to make the most out of your time. So, just know that this happens to everyone.
And we're going to take a quick time out to talk. Again, but this time with Alex Norwood, one of our other peer advisors. So I'll pass it over to him.
All right, like Christian said, my name is Alex Norwood. I'm a sophomore studying supply chain management and international business with a minor in Spanish. This past summer, I went on a cultural immersion trip to Puerto Rico with UT. It was incredible. It was so much fun, learned so much. But one of the things that was very interesting was just being situated within another culture. And especially for a lot of people on this Zoom who are going to be gone for a full semester, several weeks at a time. I also recognize a lot of names on this Zoom, so I'm really excited for y'all, and I'm excited to hear about where y'all go. But as far as culture shock goes, the biggest piece of advice I could give is to just, I guess, pace yourself, is what I would say. You're going to be surrounded by a lot of new things, maybe a lot of familiar things too, as far as fast food restaurants that are American based, that are all around the world, stuff to remind you of home. But I would say to pace yourself and try everything. Maybe not all at once. Maybe that might be a bit overwhelming at first, but definitely don't shy away from things just because they're not something that you would normally do. I mean, you're only going to be abroad for a short amount of time in the grand scheme of things. So you really want to maximize your time there. Another thing that I would suggest as far as handling stress, I'm currently planning out my semester abroad in Spain for next year. And one thing I'm definitely going to bring is a journal, something that'll kind of help you process every new experience that you're going through and allow you to really take everything in and appreciate it for what it is. Um, so yeah.
Thanks, Alex. We'll turn back to Dondre. He'll talk to us about mental and physical health.
Thank you. So it is very important to know what the rules and requirements are for your location in terms of, again, your current medications. We want to look at the legality of those medications, see if it's legal there. If not, we can help you, or International SOS can help you find like an alternative. Additionally, in some locations, you may need to have an immunization. You can find the CDC page for the country that you're going to and see if there's any like immunizations that are required or recommended. Some of that might have more to do with the exact area within that country, like, rural versus urban and so on, and whether you're going to be spending time with animals or not. So, just be mindful of that and speak with your doctor if you have any questions. And it is very important that you have proof of your health records and your vaccines. If you're going to like a doctor for the first time and speak with them about a condition or what have you, they're likely going to ask for your records to know what vaccinations you have had previously, if you have any sort of medical conditions and so on. So it's a good idea to have up-to-date records. And finally, for this slide, I would note that there is a quarantine benefit. It's $2,000. That's also in a later slide. So if you do get COVID during your program or like another type of illness that requires kind of a strict quarantine, which may depend on the location, then there is a quarantine benefit for the insurance policy that all the students here will hold. Next slide, please. Thank you. So here are some of those resources. So first and foremost, travel support in the moment. When you are abroad and you are sick, or you are wanting to get some mental health support or what have you, reach out to International SOS and they can connect you with a vetted provider with which they have a direct payment system. So, if you're able to, if you do reach out to them and have them do this, then they're able to pay the bill and then direct that to the insurance company directly instead of having you pay the bill and then file a claim. If you do get medical care prior to reaching out to International SOS or us, then chances are you're going to be paying for that bill and then you're going to have to file a claim. We do have a claim form that you can complete so that you can get that money reimbursed. But again, the most ideal thing is to reach out to International SOS as they also vet the providers. So you're not just going to go to any pharmacy or any doctor. It's actually going to be a location that's been looked at. And the CDC, again, they do have very helpful pages again on the vaccinations and, common types of diseases and illnesses and the location. So it's a good idea to look at that page for the country where you're going. And the U.S. Department of State as well does have a travel advisory page for every country and some general information that can be very helpful. Okay, so some general information regarding the health insurance policy. So there is a $500,000 total maximum per covered accident or sickness. So that's a pretty high amount. So, you should be covered for, all those covered expenses during your program. There's also a $0 deductible per covered accident or sickness. So if you know what a deductible is, you know that it's really good to have a $0 deductible. If you don't know what it is, you can Google it or ask your parents, but it's basically what you have to pay before the insurance policy kicks in. So for it to be $0, it's very helpful. And there is also an emergency medical and security evacuation benefit. So let's say that you're in a country that, doesn't have the best medical infrastructure as decided by international SOS and the care that you need. You're not going to be able to get the quality of care that's necessary in that country. There is an evacuation policy so that you're able to get evacuated out of that country and go to a nearby country that has the care that you need. And additionally, security evacuation benefits. So, thinking back to what happened in Hong Kong a few years ago, a lot of American students were evacuated out of Hong Kong during those mass protests. And the insurance policy does have a security evacuation benefit that would be helpful in that scenario. And finally, again, there is a $2,000 benefit to help cover quarantine expenses. So if you do get COVID during your program, you have to quarantine, then, this can be helpful in terms of food and the hotel and so on. Okay, so there is a QR code here for the International SOS app. I do recommend that you scan it and download the app. We did just have some technical difficulties. So whenever you scan this, you may have to click register or create an account and then use your UT email address. So that the membership ID number is there. You may need that. And you may, again, have to create an account. If you have any technical difficulties, you can reach out to us and we can help you with that. But just to kind of give you an idea of what International SOS is, they do have information that's very comprehensive about every country that our students travel to. So over here in the orange and yellow section, we have road safety and advice. And then over here in the blue, there's more like, medical information. So if you go to International SOS, and I know that you just shared a link, Rachel, I'm not sure which one you shared. So I'm just going to go ahead and share this one real quick. And this page will take you to like the UTK International SOS page. If you click on custom location reports, you can actually click the country that you're going to be studying in, and sometimes the city. And that'll kind of show you that full comprehensive information from International SOS about that location. So it's very helpful. I think there's also a link to the app there. You can also find the membership ID. If something does happen while you're abroad and you call International SOS, you'll either need to say this membership ID number, or you can just say, I am a student at the University of Tennessee, and they're able to look it up. And you can see some of those phone numbers around here. You can call any of those to reach International SOS. Thank you. And some additional information. Again, if you're trying to get medical care while you're abroad, it's good to call International SOS first, because then you're able to go to a vetted provider and the bill will likely be taken care of on your behalf so that you don't have to pay for it. There's also some pre-departure resources. And again, there are some country-specific destination guides and an app that hopefully you're able to access with the steps that I outlined. And the first case study, I think that's going to be Annalise.
Yeah, so what we want to do now is have you guys think about some situations that you might find yourself while you're abroad, or that maybe your roommate or a friend, right, may find themselves. And so this is sort of like a what would you do here, or what do you think that you should do, right? So if you take this one, this is a pretty common one. You're a couple weeks into your program in Ghana and you start to develop a cough. Pretty common. Something else that's common is that somebody in location will tell you it's probably X, right? So in this case, they say it's probably malaria. You've been taking your medication and you feel fine apart from the cough. What do you think you should do? You can drop it in the chat. I want you to think back to what Dondre has just told you. Think back to the resources that you've already been given. What do you think you should do here? Thank you, Zachary. Zachary says, call the helpline and go to the doctor. Anybody else? Anything you would add there? Zachary, I think that you're close. Lauren agrees. Thank you, Lauren. All right. Yes, you're going to call something. Helpline here would be call International SOS. The reason why we want you to call International SOS is because they are going to help you find a place to go in Ghana much faster than we could. And sometimes much faster than even your provider could, because the reason that we want to make sure you're calling International SOS is think about your insurance, right? Your provider, your institution, whoever you're with on your faculty directed program may or may not know if the clinic that they're taking you to takes your insurance. International SOS does. So please call International SOS. The second thing you're going to do is contact your program leader and or local staff, because they're going to help you get to the place that International SOS tells you to go. So we really, really encourage you to use ISOS as a support here. They're great. They have a lot of experience. They have a lot of staff. They answer the phone 24/7. And we want to make sure you get the help that you need, no matter where you are. All right, let's do another one. You wake up one morning and you discover that your roommate has not returned home from the night before. You gather your friends and you decide to call him. You don't hear anything. And then you decide to all head on to your first activity of the day. Okay. So now in terms of this scenario, I want you to think, if this were you, what are the good things about this? And what are things that maybe shouldn't have happened here? You can drop those into the chat. What do you think should have happened here? What was good about what happened here? All right, let's talk through the good things. What are the good things? We can pop them up on the slide. The first thing is this person realized their roommate was missing. It's a big deal, right? Like as we think about the buddy system and the advice that we give you all, it's important for you to be aware of where your friends are, where your roommate is, right? And let people know if somebody in your group did not show up or did not come back home. You gathered others who knew where your roommate could possibly be, and you did attempt to contact the student. In terms of things that maybe did not go so well about the situation, you did not notify your program leader. So in this case, we would always recommend you reaching out to your program leader if you have any concerns. It does not have to be an emergency, right? Always let them know that somebody's missing, somebody didn't show up, somebody's not feeling well, somebody seems a little off. That's a great thing that you can do as a friend or as just somebody as a part of your cohort on your program. And the other thing, we'll talk a little bit more about this, but your roommate should not have gone out alone. Right? We do not encourage anybody, as you guys are traveling, we don't encourage anybody to go out by themselves without a buddy. Do not leave the restaurant or wherever you guys are alone. Even if you've made a new friend, right? Make new friends in groups so that these things don't happen. I think we got one more. Okay, same thing. Late night walk, we're going to think what's good, what's not so good. You've been walking home with 3 friends at 2:30 in the morning after a night out on the town. You notice a person has been following your group for the last 10 blocks or so. You walk a few more blocks to be sure and test it out. You all then decide to step into the lobby of the first hotel you see and ask for assistance. They encourage you to sit in the lobby, wait a few minutes, and then they call you an Uber. What do we like about the situation? What's not so great about the situation? You can drop it in the chat. Andrew says, call their mama. She'll know. That's probably for the roommate one. Sorry. Zachary, Uber's a bad idea. The police would be better. Roshni, it's good they were aware they were being followed. Charles, out too late. Charles is going to keep the curfew for everybody. So I think this is good. This is the right type of thing that we want to be thinking about. You guys were already, or you were already using the buddy system, and you stopped immediately to ask for help. So that's good. Some things that we would not recommend. So don't test it out. Don't try to figure out if you can be sure of what's going on. If you have that gut instinct, and I think we'll hit on this a little bit in the future slides. If you have that gut instinct, stop immediately and ask for help. And then somebody mentioned Uber was a bad idea. Uber's a bad idea if someone else is calling it for you. Call your own Uber, call your own taxi, right? Do not let somebody else book transportation for you, even if it's, you know, a hotel lobby, for example. Please book and get your own transportation and taxi. That's going to be the safest thing. One thing I'll say before we pivot back to, I believe, Dondre here, one thing I'll say is that every one of these case studies were legitimate things that have happened within the past year with students. So these things do happen, right? And everybody, you know, all of these stories do have a happy ending, but at the same time, we just want you to know these are things that you could experience, and we would rather you be ready and be thinking through them than be surprised or be wondering what your behavior should be in that moment. So with that, thank you. I'll pass it back to Dondre so you can talk through the resources to help align with some of these case studies we just talked through.
Thank you, Annalise. So here are some of those resources. Again, with International SOS, you want to make sure that you're calling them in the moment when you need care, so that they can connect you with a vetted provider that they can pay the bill for. You will need to file a claim with Chubb if you don't do that. If you just go ahead and get your own care without, contacting International SOS. I think we already went over this slide, so I'll just go ahead and hop on to the next one. And there are some common incidents and global safety concerns and some general safety guidelines that we're going to discuss. So first and foremost, or maybe not foremost, but, lost and stolen items. Unfortunately, things do get stolen sometimes. Sometimes you might lose something. So you do want to, again, have a plan for these types of incidents. Especially with your passport, it's best for you to just not lose it and to know where it is. Of course, you're going to have to take it with you abroad. I do recommend once you're kind of settled abroad, just kind of leaving it in a locked and secure space in your room. If you have that, you can carry a photocopy of it and also have a photocopy of the entry stamp page, just in case. And of course, with any sort of, possessions that you lose, it's a good idea to file a police report in case you do have your own travel insurance that you separately purchase, because you will need that report to be in place in order for you to get those funds returned. Secondly, alcohol-related incidents. I think that alcohol is typically a major factor in a lot of the incidents that happen during study abroad programs in terms of injuries and so on. So please just make sure that, you're watching how much you drink, if you drink at all. As we're going to talk about later, remember that student conduct is still in place and that you are a UT student. And interpersonal conflicts, these happen here in Tennessee and also can happen abroad, in terms of having some sort of disagreement or or an issue with someone in your class or someone that you live with, in that case, it's a great thing to like reach out to the on-site staff and inform them of it, and then also reach out to Programs Abroad so that they can be helpful in this scenario as well. And some general global safety concerns. So natural disasters do occur from time to time, whether it's like, the volcano erupted in Iceland, or like a fire that's going on in Portugal or Greece or what have you. So please just be mindful of this, follow local news sources. The same thing goes for terrorism. Unfortunately, this does happen globally in the US and other countries and so on. So it's a good idea to be aware of your surroundings and know that this is a risk. Street crime as well, especially in cities, though, don't think that you're completely safe in a rural area. So just be mindful of that, know where your wallet is, know that if you're in a very packed area, that you should probably be mindful of what's in your pockets and so on. And political and civil unrest, this does happen in probably every country in terms of social unrest, political unrest, things that happen in regards to laws that are being passed and so on. So again, follow those local news sources. And if you see any protests or any sort of rallies, please do not attend it, go somewhere else. Any sort of rally or protest that starts peacefully may not end that way. And I know that the State Department typically or always recommends that you try to avoid any sort of protests or rallies while you're abroad. And on that note, the Department of State does have a worldwide caution alert that's currently active. That's for all countries, all travel. This just basically says that, due to what's been happening for the last month and a half or so, and global tensions that are currently rising, that there is an enhanced or elevated threat to American citizens abroad. So you do want to make sure that you're being very aware of your surroundings, especially in very touristy areas. You can go to the State Department's webpage and look at this for additional information. If you go to their travel advisory page, there's like a yellow or orange band at the top. You can click on that and get some additional info. And finally, crowd safety. So as we saw in Seoul, 2 Halloweens ago at this point, unfortunately, sometimes there's events that there's way too many people at, and it's not being super regulated, and this can get very dangerous very quick. It goes without saying that the vast majority of events don't have this type of incident that happens. But if you're in a crowded space, just make sure that you know where the exit is, make sure that you're staying hydrated, and just make sure that you're, keeping yourself safe. Okay, and communication. It's very important that you always have a charged and accessible cell phone in case of emergencies. We're going to be reaching out to you if something's going on and we need to know that you're safe. It's a good idea to have one of those portable batteries with you, so that you're, especially at the airport or the train station, you're able to charge your phone and be able to check emails, respond to emails, make phone calls, and so on. Of course, if there's anything that's happening abroad, any sort of issues or concerns, you need to report that to the local staff. You can also reach out to PAO as well for support from the Programs Abroad office. As Annalise touched on, you definitely want to have a buddy system and never leave your buddy behind. That kind of defeats the purpose of the system. Make sure that you're looking out for your peers and avoid potentially dangerous situations, walking in dark alleys, or, going out alone, or, going to someplace with someone that you don't know, of course. And pay attention to your intuition and your gut. If something feels off, you want to make sure that you're listening to your gut and being as cautious as possible. And please be conscious and respectful of the cultural norms in that location. Know what's appropriate, know what's inappropriate. This could be in terms of PDA or clothing in certain locations. And finally, you want to know the address of the nearest hospital and the U.S. Embassy as well. So I do recommend that you have the phone number and the address saved in your phone, or like a Google Drive or what have you, so that you can access that information.
Okay, so we're gonna turn to Kendall, speak for a moment, and so I'll have Kendall introduce herself, and go ahead.
Hi guys, I'm Kendall. I'm a marketing and human resource management major. I'm a sophomore, and the program I went on was Germany, and I actually did that this past summer. I did the May mini term, so that was only 10 days, so not a super long program, but still safety was super important on that. So I'm going to kind of be repeating a little bit of that because overall, common sense and situational awareness is going to be the most important thing about safety abroad. So the buddy system was a huge thing for me on my program. I always kept up with my roommates before we went to class in the morning, and before we left class, I'd make sure, okay, here's my roommate, here are my friends, we're all going to get back together. And just if we went out for dinner and everything, if someone wanted to leave early, don't let them go by themselves. And also, if you wanted to leave early, don't go by yourself. Always make sure you had someone with you, no matter where you were. And also communicating if you went out. So if you are on a longer trip where you can go on a weekend excursion, just making sure you tell your roommate or a friend or one of your support systems in the country that you are going to this place. This is where you're going to be staying. This is when you're going to be back. And that's also important, even just for night outs. Tell someone where you're going when you plan on being back, and just let them know when you get back to your hotel. And then again, for the global awareness part, for me personally in Germany, I was in 3 separate cities, and 2 of them I wasn't staying in the safest part of the city. We were staying a little bit closer to the central train station, which did tend to have a higher crime rate. And a big part of that is just making sure if you're in a crowded area, maybe you've got your bag towards the front of your body. So if there are people all around you, you can see if someone's reaching in. Keeping your passport, if you're coming back and forth from the airport, in an inner pocket that can't be easily reached if someone was to pickpocket. Just having a good grip on all of your bags. And another big thing would be having a plan B for everything. So while I was there was a strike, a transportation strike on the day I had to take a 45-minute train ride back to the airport. And I was lucky that Germany does plan these things out. So we did know a little bit ahead of time, and we had some backups like taxis and Ubers. So we could do that if we happen to not be able to take the train. So just having backups like that, and backups for if your phone dies, like having maybe the physical address of your hotel written on a piece of paper in your wallet. That was something we did because we couldn't rely on people speaking English if we needed to get home, and I couldn't rely on my phone being charged to pull that address up. So those are just some good things to keep in mind while you're there. But overall, just make sure you have a buddy, keep an eye out for those alerts, and just be aware of the type of situations you might be in.
Awesome. Thanks, Kendall. So
Thank
now we're
you.
going to turn back to Dondre, talk about emergencies versus non-emergencies.
Okay, so as he stated, we're going to speak about emergencies and non-emergencies, and also what the emergency abroad protocol is and who to contact in those situations. So these are some examples of emergencies abroad: an accident that threatens your life or the life of another, a life-threatening illness that presents extreme or concerning symptoms, an attack or a sexual assault. Like I should note here that we do still contact the Title IX office if a sexual assault happens abroad and we're made aware of it. We are all mandatory reporters, and if you're curious about what the process is and what the resources are, you can look over the Title IX page, and that kind of outlines the process, all the steps that are going to be taken, who's going to be informed, who's a confidential resource, who isn't, and so on. And just know again that we do have mental health support available for all travelers. And local or world events that could threaten your health or safety and your location. Again, this could be anything like a social unrest or a disaster or what have you. Thank you. And then these are some non-emergencies. So a lost or stolen credit card. In that situation, you're going to want to call your bank and get those frozen and get the process started on getting a new card and making sure that someone can access your funds. And you would also want to contact your local program staff so that they can assist you. They may have a procedure in place. And in terms of a rescheduled or delayed or missed flight, of course, you're going to want, and actually, I'm not going to say the answer to that because we have that on a later slide. That's a question. And then a mild illness with which you are familiar, such as a common cold, a stomach ache, allergy issues, etc. Next slide, please. So here's the action plan for an emergency. So the first thing that you're going to want to do is to call the local equivalent of 911. The State Department has on this page all of the local 911 numbers for every country. So I do recommend that you look at this and know what that local equivalent is. The second step would be to communicate with the program leader or in-country program contact. So if you're at an exchange university or what have you, then that might be someone at the study abroad office. And then of course, calling International SOS if you need any sort of medical support. If it's one of those safety situations in the area in terms of a disaster or what have you. And finally, there is a 24/7 emergency phone number. And also, of course, the International SOS system is 24/7 and worldwide. Going back to the 24/7 Programs Abroad phone that is carried by myself or the Assistant Director of Global Health, Safety and Security, or the Director or Assistant Director of Programs Abroad. Just to let you know that these are UTK professionals. Two of us are here on the call, so you'll know who's going to be on the other end of that phone. And if you do have WhatsApp, you can text WhatsApp if it's an emergency situation, you want to text or what have you. Of course, the call might be better, but just know that that's an option. And for non-emergency situations, so please, of course, still communicate with the in-country contact. So you have a stomach ache, you need some help, getting some medication. Or you lose your credit card, you do want to make sure that you're in contact with that local contact that's best positioned to support you in that situation. And of course, you still want to notify PAO so that we can assist you and support you in that situation as well. Okay, so again, you do want to be prepared. That'll eliminate a lot of the stress in these situations if you already have a plan in place. And please do understand that emergency protocol and familiarize yourself with these resources that we have shared. There is the STEP program through the State Department. I do recommend that you enroll. If somebody could drop a link, please. So basically, anytime you're abroad, you're able to make the State Department aware that you're abroad, what the location is, what the address is, what the dates are, so that if something does happen, they are able to support you and they know that you're there. So I do strongly encourage you to enroll into that program. And again, please save the local 911 equivalent phone number on your phone, or just know what it is. It's also a good idea to save the phone numbers for the local program contacts. That CGE PAO emergency phone number that was shared on the previous slide, and the International SOS 24/7 phone number. There's one for the Philadelphia headquarters, but then there's a lot of different phone numbers. So, if you're in Japan, they have an office in, I think, Tokyo that you can call, but, there's a lot of different offices. You can call whichever one is best for you. And please do make sure to make hard and digital copies of your passport and your visa if you have a visa. It's also good to take your vaccination card or a copy of it with you. Of course, at this point in the pandemic, there's not nearly as many travel restrictions in regards to COVID and vaccination and testing, but it is still your responsibility to be familiar with those. And if you are vaccinated, it's not a bad idea to take a photocopy with you. And in terms of the international insurance coverage, it's not a bad idea to have a hard copy of that, or a digital copy in the Google Drive or what have you. Here's a link to that if you want to look over that policy. One thing that I will note is you might see something kind of, hidden in there almost, that speaks about trip interruption or trip cancellation. That is specifically if you say, like, there's some sort of social unrest and your flight, is canceled or what have you, or you have a major health condition and you have to like reschedule a flight or what have you while you're abroad. In that situation, there might be some like travel insurance type, benefit tied to that medical or security situation. However, general travel insurance, you're going to have to purchase on your own. You can do a Google search and try to find like, the best fit for you. And please share copies of your important documents with your family and your emergency contacts. So this is what I was speaking about before. So you were at the airport and you miss your flight to your abroad location. What is the first thing that you would do? Please just, drop a letter in the chat of what the correct answer is to this question. Okay, I see we have A. Thank you, Evan. C, D. Okay, I think we have every letter of the alphabet in here almost. So the correct answer is to schedule a new flight. The first thing that you're going to want to do is to speak directly with the airline and get your flight situation taken care of. The second thing is to contact your on-site program contact to let them know that your flight is delayed or you missed it or what have you. If they're expecting you, especially if there's like an airport transfer or what have you, if they are expecting you to arrive at a certain time and you don't arrive, there can be concerns about, your safety and whether or not you're well and are you missing and so on. So please do contact them. And of course, you can contact programs abroad as well, so that we know in case we hear from that program contact or your family or what have you and their concern. So first things first, schedule a new flight, speak with customer service. And finally, I will note here that it's very important that you monitor your UT email, and also if you have an email address with the host institution or the affiliate or what have you, please make sure that you're viewing that email as well. In the event of an emergency, those program contacts are going to be reaching out to you and you need to be able to respond to those. So you do need to continue to read your UT email while you're abroad. And thank you very much. I think that's the end of my slides.